sure you had it there before. Hi everyone, my name is Josh Schultz and I'm here from the Medicare Rights Center to talk to you about Medicare-related low-income benefits. So just really briefly, the Medicare Rights Center has worked with CHA for, I guess, over a decade. Our organizations share the similar purpose of trying to help eligible clients enroll in and access health care benefits for which they're eligible. And there are a number of programs that apply to Medicare-related people who may transition from other programs under the Affordable Care Act and Medicaid that they may enroll in before becoming eligible for Medicare. And so we're going to talk about the programs that come along with Medicare and moving into them and the importance of screening for them. Yeah, that's a great idea. People feel free to take notes or interrupt me with questions. We'll also pause periodically for questions too. One more. Okay. And then why don't we also pass this out. This is an overview of the benefits we're going to talk about today. Specifically this chart right here. Don't need to get too hung up on it, but just you may want to reference it periodically. It talks about the different programs we're going to be focusing on today. The Medicare savings programs. Oh. And the Medicaid eligibility limits for the people who are also eligible for Medicare. So the Medicare Rights Center is a nonprofit consumer advocacy organization. Like CSS, we help people through a consumer helpline and through advocacy and outreach throughout New York State and the United States. These programs specifically that we're going to be talking about today are Medicaid, Medicaid for people who are aged 65 or older, blind or disabled. Extra help for prescription drug costs associated with Medicare Part D, the prescription drug benefit part of Medicare. And really, really important, the focus here is going to be on the Medicare savings programs, or MSPs as we call them, which pay for Medicare premiums and other benefits for everybody who gets them. And we're also going to talk briefly about an additional program called a State Pharmaceutical Assistance Program, or EPIC. You just need to remember the word EPIC, and we'll get back to that at the end of the presentation. And while this wasn't on the introductory slide, SSI we also want to chat about briefly because it relates to all these other benefits, and it also causes anybody who has SSI and is eligible for Medicare to get all these other benefits automatically. What benefits have people covered so far in terms of Medicaid and SSI, for example? Have you talked about SSI? A little bit? Okay.
Well, more in terms of Medicare, right?
No, we haven't gone over
Not really.
Yeah, no.
Not any.
Okay. So we're not going to go into too much in terms of what SSI does beyond the fact that it's a supplement, income supplement program for people who have both very limited incomes and limited resources, less than $2,000 for a single person or $3,000 for a couple. So it's very restrictive. And it's for people who are at least 65 or older, blind or disabled, and who meet other requirements. People who get supplemental security income, as I mentioned, they automatically get Medicaid here in New York. And if somebody has SSI and they're eligible for Medicare, they will automatically get the Medicare Savings Program in addition to Medicaid. Can somebody give me just kind of a general gist of what you talked about regarding Medicaid yesterday or the day before?
Yesterday was Medicare.
Yesterday was Medicare.
Yeah.
Okay.
The Medicaid day, we did the Medicaid benefits. eligibility for it, package, both Magi and non-Magi.
Okay. So, correct me if I'm wrong, Katie, but we don't have a different benefits package per se for people who get Medicaid here in New York under the Magi rules or under the non-Magi rules, although there are certain
The only thing that
certain
differs
things.
from long-term care.
LTS, yeah. So really, it's similar. People who get Medicaid in addition to Medicare get Medicaid benefits through the Medicaid fee-for-service program, so they don't have managed care, usually. And again, it's for people with low incomes. While people under 65 and who are not disabled under the Affordable Care Act have both an expanded income limit for eligibility and they don't have any asset test to get Medicaid, that changes at age 65 or when you get Medicare. And the limits are roughly, I think, $14,500 or so for a single person and about twice that for a married couple that lives together. Some types of income for Medicaid for the age-blind disabled population is not counted. And we'll talk about that a little bit more because the eligibility rules for Medicaid and the MSP in terms of how income is counted are very similar. As far as coordination of benefits between Medicare and Medicaid, Medicaid always pays last, and in this case, Medicare is first. So Medicare pays first, Medicaid pays second. If somebody has some sort of supplemental insurance or other coverage besides Medicare, employer insurance or something, then it would depend on the coordination of benefits rules between Medicare and that insurance. But if somebody just has Medicare and Medicaid, Medicare is first and Medicaid is second. We're also going to talk about extra help, and I'm going to mention this throughout this presentation because extra help is the benefit that works with Medicare Part D to help people afford and access their Medicare Part D prescription drug costs. And what's really important is that extra help is a federal program. It's federally administered, and it works together with Part D, but people get it automatically by having a number of other programs. And we're going to talk about how that works on the next slide or two. But for people who don't get it automatically, well, basically, the emphasis here is that a lot of people call us and call our helplines with questions about affording and accessing health care and their medications. And if they're eligible, extra help gets rid of the Medicare Part D coverage gap, informally known as the donut hole. That's, as you probably learned, is where Medicare Part D plans will pay and cover claims up to a certain level, like around $3,000 of claims paid between the patient and the Part D plan. And then there's a big gap where people have to spend everything out of pocket before the Medicare Part D plan will continue covering their costs. So that could be, I think, $2,000 or $3,000 where they have to pay out of pocket. If you get extra help, any type of extra help, because there are different levels, all of them erase the coverage gap. The donut hole disappears. And that is perhaps one of the largest benefits to any of these other programs, is that you lose, your donut hole goes away. The combined value of these benefits, we like to tout it at about $5,000 a year, in large part because it closes the donut hole. It's really important to screen clients for benefits, and I'm sure that Katie or other people have gone over with you the actual processes that you go through for screening them. But in the context of the Medicare savings programs and extra help, but the Medicare savings programs specifically, the enrollment in them is quite low. So for other federally required low-income or moderate-income related benefits, like, for example, the Earned Income Tax Credit, the take-up rate, so-called take-up rate, or the number of eligible people who are enrolled in it, is 80% or more. SSI, Supplemental Security Income, which we discussed before, that has a take-up rate of, I think, around 70%. But if you look at these percentages here, and actually I think these are outdated, and the numbers are actually lower. I've seen lower numbers for QMB, but 65% or less of people eligible for QMB are enrolled in it, and it just gets worse and worse as you go through the different programs. The different programs being, they're all the Medicare Savings Program for Part B premiums, but they are given to people with different income levels. So because of this historically low take-up rate, we really push enrollment and screening for eligibility for the Medicare Savings Program, which can really, really help people not only afford and access care, but I mean, they get $105 back into their check if somebody's paying their Medicare premium for them. And for people living on $800, $900 a month, that can go towards rent, towards food, towards a lot of things. We're going to go back a little bit more into detail about Extra Help now. So it's a federal program, as I mentioned. It works only with Medicare Part D. People who are of the Medicare population may call you and they may say, oh, I've got retiree coverage or something, and that covers my prescription drugs. Retiree coverage might be a Part D plan, it might not be. The point is that Extra Help works with Medicare Part D. And if you get Extra Help and you don't already have Part D, you are enrolled into Part D. And so it allows you to enroll into it outside of what would be otherwise a potentially restricted enrollment period. Extra Help for Medicare Part D costs is also known as the Low Income Subsidy, or LIS. You don't necessarily have to remember that, but I imagine if you're reading through case notes or reading somewhere, if you see Low Income Subsidy in the context of Medicare, it means Extra Help. If you don't get Extra Help through one of these other ways, if you don't get Extra Help by the virtue of having another program that gives it to you automatically, then you have to apply for it directly through the Social Security Administration. And these are the income limits when you apply directly through SSA. 1436, actually these are last year's limits, I think. 1436, it's a little higher this year, but it's around there. Unlike getting this program through having SSI or having Medicaid or having the Medicare Savings Program, if you apply through Social Security, you have to meet these income guidelines and you have to meet the asset tests that Social Security applies to these programs, which is roughly about $13,300 for a single person and $26,600 or so for a couple that's married and living together. So it's not nothing, but a lot of people do have more than that saved up. And so if people can get Extra Help without having to apply for it directly and can get it, for example, through the Medicare Savings Program, they might not have to meet that asset requirement. So Extra Help benefits, I mentioned this, but the Extra Help program will pay up to a certain amount of Medicare Part D drug costs. It can allow people to get free Medicare Part D, but Medicare Part D plans differ in terms of the premium, and so it might give it to them for free or it might give it to them for a very, very reduced cost. It will give people low co-payments on covered Part D drugs, so it might be $2 and change, $3 and change, $6 and change. It depends on the income level and on the reason the person gets Extra Help. One of the biggest non-affordability related reasons to get Extra Help is that it allows you to switch your Medicare health and drug coverage every month, any time of the year outside of Medicare's annual fall open enrollment period. It gives people a once monthly special enrollment period they can elect. So they can move from getting their Medicare benefits through the fee-for-service original Medicare program administered through the federal government to a Medicare Advantage private health plan, or they can move from one Medicare Advantage plan to another. They can move from one Part D plan to another Part D plan. Once a month, it'll take effect the first of the following month. So I mentioned you can get Extra Help by having some other programs. Here are the three that you can get it automatically as a result of having them. You can get it because you have the Medicare Savings Program, because you have Medicare and Medicaid, or because you have Medicare and supplemental security income. In the case of New York, as I mentioned, SSI gives everybody Medicaid, and if you're eligible for Medicare, it also gives you Medicaid and the Medicare Savings Program. So I keep mentioning the Medicare Savings Program. Here's what it is. They provide help with Medicare's costs. Medicare savings programs are a federally required benefit, but states administer and screen and enroll people into them. So they're not administered at the federal level in any way. You apply through the Medicaid office, and that's here in New York City, the Human Resources Administration, HRA, or you hopefully apply through us at the Medicare Rights Center. We help clients from the 5 boroughs and Nassau County enroll, and we can help people begin and complete applications anywhere in New York State. While the slide says asset tests between states differ, that's not really relevant here because we're here for New York today. And there is no asset test for the MSP in New York. Let's see if I can pull this up. Now, if you see here these program types, QI, these are all the MSPs, but if you look at the top level, it's also on your chart. But if you look at the top level, they're about $1,333 per month for an individual or $1,790 per month for a couple. That's roughly the Medicaid income limit for a single person or a couple, a two-person household, under the MAGI budgeting rules. So the Affordable Care Act expanded coverage for people under 65 or who don't have Medicare and they don't have an asset test. Similarly, the MSP program, which pays the Medicare Part B premium and can help with other things, it has a similar eligibility test. And here in New York, there's no test on asset limits. So somebody might have gotten, Medicaid under the ACA, and say they make about $1,300 a month, and then they're turning 65 or they're getting Medicare, and they find out they're going to lose their Medicaid at some point. The MSP is a really good thing to screen these people for and identify them, because then they can be enrolled into that and at least get some assistance through that with their Medicare premiums and other costs. So you've seen all these three different types of MSPs, and you don't need to memorize them, but they're QI, qualified individual, SLMB, SLMB, and QMB, QMB. The top two, they're basically just, they differ. The MSP people get differs depending on your income. You don't really get to choose which one you get. And we're going to go into the details of each one. So here are the income limits. You see that QI has the least restrictive income level, and SLMB has a little bit more restrictive income level, and then QMB is much lower. Again, you don't really get to choose, although the amount of your income that gets counted can differ depending on the circumstances. If you don't take away anything else from this presentation, I want you to take away that first bullet point at the top. All of the MSPs pay the Medicare Part B premium for people who have it. And they enroll people, in addition to paying the Part B premium, they do enroll people into Part B if they don't already have it. You probably talked about enrollment into Medicare during your other Medicare training, and you probably heard that there are pretty restrictive rules about enrolling into it. So really the biggest problem that we see is people who don't get into Part B because of misinformation or because they're confused or any number of reasons. And the MSP, especially here in New York where there's no asset test for it, it can get people into Part B if they're locked out otherwise because of those restrictive enrollment periods. If somebody didn't enroll in a timely manner into Part B and tries to get in later and they're owing a late enrollment penalty, that can be for as long as they have Medicare, for the rest of their life. And if you get the MSP, it erases the late enrollment penalty, both for Part B and for Part D, because Part D, prescription drug coverage, also has a late enrollment penalty. In any case, it erases the late enrollment penalties even if you later lose the MSP. That's really important. You can lose it and then you have to pay a premium, but your penalty's gone. And finally, all three MSPs provide automatic eligibility for extra help. You automatically get extra help. Your name goes on a special list somewhere that gets sent to the state of New York, that gets sent to the federal government, and they give you the best kind of extra help for at least that full year, as long as you have the MSP and it can continue even after you lose it. I got ahead of myself a little bit. So the MSP, as I mentioned, you don't have to be in an enrollment period. You also don't have to have Medicare Part B in order to apply for an MSP. You do have to have a part of Medicare. So if somebody doesn't have Part B, they have to have Part A. If people don't have Part A or Part B, it's a bit more of a complicated process to enroll them. That can happen if somebody calls you, they're over 65, but maybe they came to this country late in life and they didn't pay Social Security taxes, so they don't qualify for Medicare Part A for free. And if you don't qualify for it for free, you have to pay the full value of that benefit each month. And in effect, what it means is that a lot of the people then don't pay for it because it's $426 a month. So if you don't have Social Security benefits, you might not be able to afford that just for one part of your health coverage. But you need Part A or Part B to apply for the MSP. You don't need both. If somebody doesn't have either, there is a two-step process to get them into it. And we, depending on the amount of time, we may be able to go into that, or you may want to refer that to one of the case handlers for additional assistance. But it requires going both to Social Security to enroll in one of the parts of Medicare and then going to apply for the MSP. And that's a two-step process that can be very, very difficult for clients. I mean, these are already difficult enough to navigate. QI and SLMB, the two highest ones that only pay Part B premiums and give you extra help, but they don't pay for Part A. They're both retroactive up to 3 months. And what that means is that if I apply for QI or SLMB today, it's June, and I sign it this month, I apply, miraculously my application's approved this month, and I get an effective date of July 1st, then I get coverage retroactive 3 months, which means that when all is said and done, several months down the road, I'll actually get a reimbursement into my bank account, into how I get my Social Security, of any Medicare Part B premiums that were taken out during the time since I was approved, and 3 months back.
But only if you qualified 3 months before, right?
Yeah, only if you were eligible for Medicare. So I would end up getting the 3 months prior to July 1st, in addition to any premiums that I had withheld while I was waiting for the MSP to go into effect, because it can take a little while to go into effect. There's a lot of data transfer that has to move between the city, the state, the federal government, and different parts of the federal government. But both QI and SLMB, they both pay the Part B premium only. They give you extra help, and they're both 3 months retroactive. Unlike QI and SLMB, which have the higher income levels for the MSPs, QMB, or Qualified Medicare Beneficiary, you don't have to remember that, but QMB is a better MSP. It's not retroactive, and so that can be difficult. But unlike the other MSPs, QMB pays for Part A if somebody doesn't qualify for Part A for free. So again, that's $426 a month. A lot of people can't afford that. And so it'll pay for both Part A and Part B. And it'll give all those other benefits for somebody. So it'll give them full extra help with their prescription drug costs. In addition to paying for Part A and Part B premiums and giving them extra help, QMB also pays coinsurances and deductibles for Medicare Parts A and B. So it's sort of, QMB, having Medicare and QMB is sort of like having a type of Medicaid, in that you can go to a Medicare provider and then your Medicare provider can submit the claim to Medicare, and turn around and submit the costs, like the copays and the deductibles, to Medicaid. And if you have Medicaid billed for it, then they will come back and pay the difference, or at least protect the person from being billed for the difference. And there are some protections for people who have the Quimby program. They aren't allowed to be billed for anything beyond Medicaid-allowed copays, so about $3 a service for anything, for any Medicare provider who sees them for some Medicare-covered service. And that's huge. So somebody, especially people who are in poor health and have limited incomes, if they get the Quimby program, they're essentially protected from any out-of-pocket costs. And that's a big deal. Studies have shown over the course of the Quimby programs existed since, I think, 1988, but it hasn't really been put into effect until a little bit more recently than that. But they've looked over time at people who get Quimby, and they've seen decreased premature death for people who get the benefit, because they are able to go to the doctor without worrying so much about those copays and deductibles, about worrying about the costs associated with going to the emergency room or your primary care doctor or anything like that.
Sorry, I have a quick question.
Sure.
So Quimby pays for Part A if you were not already eligible for free Part A.
Yeah.
Does QI and Quimby do the same?
No, they only pay for Part B.
Okay. Cool. Thank you.
And so what that means is that somebody has to have Part A in order to, for free.
Those two.
Yeah. They could buy Part A and then get QI or SlimB, but that doesn't happen.
Yeah.
So that's one of the other reasons that Quimby is so important. And we're going to talk about how income is counted in a moment, because somebody's income could fall into the benefit level of QI or SlimB for payment of the Part B premium only, but then they might be able to do things like buy a health insurance premium that gets subtracted dollar for dollar from their countable monthly income, and then they can qualify for Quimby. Does anybody have other questions about Quimby so far? Kind of thrown a lot of information.
If your income changes, so like what if you you have too high of an income to qualify for Quimby 1 month, but the next month you do? Can you switch? You said you could switch instead, right?
You can. If, kind of like Magi Medicaid, the MSP eligibility is evaluated on a 12-month period. And so you get approved for the MSP and you keep it at that MSP level for 12 months. If you have changes in your income, you should report them, or you're supposed to report them. But yes, so if I got SlimB, for example, and I only had the Part B payment of my premium, and my income went down, or I got other insurance that could be used to be subtracted or disregarded, as it's called, from my monthly income, I can then tell HRA about this and ask them to reevaluate me to put me into the better benefit. Yeah. And I can do that before the end of the 12 months.
Okay. Great.
Any other questions about this crazy complicated program called Quimby? No? Okay. So as I mentioned, Quimby has a federal-related balance billing protection. And balance billing, you'll probably hear that in a number of different situations. And in this case, it really doesn't mean billing people for more than the amount the insurance company would allow, which is what you might hear about in other contexts. What it means in the case of Quimby's is that they can't really be billed for anything except a nominal $3 Medicaid copayment. If they do bill them for something, for a Medicare-covered service, then the providers can be reported to the Centers for Medicare and Medicaid Services that runs the Medicare program, and they can be sanctioned, I think, up to $100 a day. In practice, it doesn't happen that often. A lot of providers don't even know what Quimby is, but it's important to educate clients so that they can then educate their providers about this program, because they really can't be billed, or it's illegal for them to be billed. And one more thing, it applies also if you're in a Medicare Advantage plan.
What about for non-Medicare providers out of network? Is there any prohibitions on that?
For like a doctor that's opted out of the Medicare program.
Yeah.
So we get some of those up here in New York, like in New York City. A number of doctors, maybe dermatologists, have opted out of the Medicare program, which means
more than dermatologists.
Yeah, gynecologists too do that a lot. And those providers have actually entered into a legal contract, a legal agreement with the Medicare program that they won't see any Medicare patients without entering into a contract with them that they're going to pay the full cost. So in the context of original Medicare, most providers take it. If they have formally opted out, then Quimby won't protect them because they will have entered into a contract with the person that they're going to pay. Yeah, exactly. They're not seeing them as a Medicare patient. But in the context of, for example, say somebody has a Medicare Advantage plan, and they go to an out-of-network doctor in the Medicare Advantage plan. Well, it really applies to services that are covered by Medicare. I guess I'm actually going to have to get back to you on that one. Yeah, because if the services are denied, the protections are different. What we say to Quimby, the people we help enroll into Quimby, is regardless of how they have their Medicare coverage, whether it's through original Medicare fee-for-service or through a Medicare Advantage plan, we advise them to go to doctors that are accustomed to billing both Medicare and Medicaid. Because if the provider's already set up to bill Medicaid for the Medicare copays and deductibles, then things go more smoothly. They can just turn around and submit it, or for clients in original Medicare, it gets submitted automatically. That's what we really advise. Obviously, it can be difficult to find a provider that takes both Medicare and Medicaid, but we do advise that people do that. They don't have to, though. And the protections against being billed apply to any Medicare-covered service, something that's covered by Medicare, even if the provider doesn't also take Medicaid. So while there's some question, I think, about the out-of-network denial, I'm not sure the answer to that one. If somebody goes to an original Medicare provider that doesn't also take Medicaid, or they go to a Medicare Advantage provider that doesn't also take Medicaid, they still can't be billed those copays. They need to be billed to Medicaid. And if the provider is not willing to bill them to Medicaid, the provider still can't bill the patient. So I mentioned this in the other couple slides, but a real key aspect of all the MSPs, again, is being automatically enrolled into Extra Help. Some people call this deeming. You're deemed automatically eligible for the benefit, and you get it. The eligibility for Extra Help, if you get it automatically, is based on the other program that gives you the Extra Help benefit. So if you have to meet the eligibility requirements of Medicaid, in addition to having Medicare, to automatically get Extra Help because you have Medicare and Medicaid, then you have to meet those income and asset requirements for the Medicaid program. If you have Medicare and the MSP, there's no asset test. So people can have some savings and get Medicare and the MSP and then automatically get Extra Help with their drug costs.
But you said that for Extra Help, normally there is an asset test?
So the Extra Help program, if you apply for it on your own, if you go to apply for it directly without getting it through another program, there is strict, yeah, even in New York.
But
it's
the
only if
MSP
you,
in New York
exactly. And so it's like a back door into it.
Got it. Okay.
Into getting Extra Help. And you get the best kind of Extra Help, the highest subsidy.
Right.
And in fact, even if you lose the MSP at a later date or you lose Medicaid at a later date, you get to keep your Extra Help at least through the end of the current calendar year. Depending on the time of year you lose it, you might get it through the end of the next year. Does anybody have questions about this automatic process for getting Extra Help and how it works and when it does or doesn't apply? I find it kind of confusing myself. Okay. Did folks go over Medigap supplemental insurance? Okay. If somebody gets Quimby or they have full Medicaid without a spend down, they can't get a Medigap policy. And that's because, and again, Medigap policies supplement costs original Medicare doesn't cover, which is another reason somebody could benefit from Quimby. So it's sort of like the chicken before the egg in this situation. You can get a Medigap before you get Quimby, but you can't, or before you get full Medicaid, but you can't if you then get Quimby or you get full Medicaid, later decide you want a Medigap.
What about the other MSPs?
The other MSPs you can definitely have a Medigap because they don't help with, they're higher limits and they don't help with copays and deductibles for Part A and B. So somebody could very much want a Medigap. And more important, Medigap premiums, a lot of people who are in eligibility categories or income categories that are above the MSP limits. So if you look at your charts, for example, somebody is a single person and their income is $1,500 a month. So the top MSP eligibility limit is $1,333. They can buy a Medigap plan or certain other types of health insurance and subtract the premium they pay for their Medigap supplement policy dollar for dollar from their countable income. And so then they can become eligible for the Medicare Savings Program that way. Does anyone have questions about Medigaps and Quimby? Okay, earlier I mentioned that you need either Part A or Part B to get one of the MSPs. If you don't have Part A or Part B, and again, this is often the case if somebody hasn't worked long enough to have Social Security working quarters to get Part A for free, then they have to go through this two-step process. You first have to, let's see if there's another slide. No. Yeah, so it's a two-step process of first going to Social Security and asking to enroll in conditional Medicare Part A and into Part B. So you're asking Social Security to give you these benefits, and then don't bill me for them until the state says they'll pay me. They'll pay for them. So it's sort of like a conditional application for these for Medicare, where you then take that conditional application status and you go and apply for the Quimby MSP. So you would get a letter from Social Security saying, I've applied for conditional Medicare Part A and Part B, and then you apply for the MSP. And then if you get the MSP will, or if you get Quimby, that will pay for your Part A and Part B premiums. So that's sometimes referred to not as Quimby, but as the Part A buy-in. They're the same thing. If you have somebody in that situation, don't hesitate to reach out to the helpline supervisor or to me or to somebody else. I don't know exactly how your referral process works, but this is very complicated to walk people through.
I have a kind of specific eligibility question.
Sure.
So in terms of you need to work 40 quarters, so if a couple is married and one spouse works 40 quarters and the other person doesn't work, that counts, right? That covers them, or no?
Yeah, if they're currently married, they can claim it on their spouse.
Okay. And what if they got divorced before that, for their spouse works for 40 quarters? Are they not eligible for Part A previously?
I think it's actually the current status of the spouse's or ex-spouse's working history.
Oh,
So,
really?
yeah, so if somebody doesn't work 40 working quarters, or they don't have a spouse who has worked 40 working quarters, they don't get free Part A. And
But
the
if
two,
divorced, it still counts.
if they're divorced and they've been married for at least 10 years.
10 years. Okay.
I've unfortunately spoken to people on our helpline who were literally married 9 years and 11 months, and it's like, are you making this up? Is that even possible?
Yeah.
But unfortunately, it does happen.
They would
Yeah.
do this stuff in.
And just as a technical matter, if you're divorced, and I think if somebody is widowed, they have to have been married for a year, something like that. So there are very specific requirements, and we've got a great website you can go to with any sort of Medicare question, and I'll show it to you at the end of the presentation. It explains that in more clear, concise language than I could do it. But yeah, generally being married for 10 years and getting divorced or being currently married. And then, yeah. The other spouse also has to be eligible to collect Social Security benefits. Essentially, being eligible or having your spouse be currently eligible to collect Social Security benefits of any sort is what triggers being eligible for premium-free Part A. Have I sufficiently confused everybody?
No, that was helpful.
Okay, no, I'm glad we could clarify that because it all ties into the
thinking about that for a while.
Yeah,
a few days,
it's
because
really
I was
crazy.
like, wait, that probably does happen to a lot of people if they get divorced, but it's good to know that actually counts if you've been married.
Yeah, if you've been married for 10 years. And again, the other spouse has to be eligible to collect. So they might only be 60, and they have to wait till they're at least 62 to collect Social Security. And as you mentioned, Quimby is a good option for that person here in New York, especially because there's no asset test. As far as counting people's income for the MSPs, I mentioned the using a Medigap premium to subtract it from the amount of income that gets counted. You can also use other types of health insurance. Parts of the premiums for Medicare Advantage plans can get subtracted from your countable income. Long-term care insurance, dental insurance, if you have like a standalone dental policy. These are all very minute, specific details, but they can be important because there are little tricks that we can do as advocates to help people figure out ways to access benefits and to become eligible for them. As far as the different types of income, the Affordable Care Act created the MAGI budgeting situation where you take a person's taxable income and you add back a Social Security and foreign untaxed interest, and then you get the entire package, and everything's based on that, basically. For people who are 65 and older, they can't just look at their tax return and do a little bit of arithmetic. They actually have to go through some complicated rules. But for the MSP, generally speaking, what gets counted is your current income and it's your gross income before any deductions. So you might be counseling somebody or working with somebody who says, you ask them how much money they get, what's their income. And they might say, oh, I make $800. And then you might want to clarify with them, or you do want to clarify with them, how much money do you make before any deductions? Because the vast majority of people who have Social Security, if they're eligible for Medicare and they're collecting Social Security, their Medicare premiums are deducted, always. They don't have the option not to have them deducted. So generally speaking, people are going to tell you the amount that comes into their bank account. And sometimes other things besides the Medicare Part D premium are deducted. So you could have Part D premiums deducted. So really people want to look at their award letters, and you probably talked about benefit award letters too. But okay, it's people who are on Social Security or on supplemental security income, federal-related benefits administered through the Social Security Administration. They get what's called an award letter each year, and it says the monthly amount of money they're going to get the following year. It also says whether or not anything for Part B is deducted from their monthly benefit. So anyway, it's the gross monthly income that gets counted for the MSP, and that's unearned income such as Social Security, pensions, unemployment insurance, workers' comp insurance. All those things get counted dollar for dollar. By contrast, if somebody who's aged, blind, or disabled goes back to work or is working part-time, less than half of their employment income is counted. You take the employment income, get a monthly average, and less than half of that is counted. And so you might be talking to somebody on the helpline who says, oh, I make $2,000 a month. I don't qualify for this. But then you find out that half of that is employment income. So less than half of that employment income is counted. Maybe they have Medicare, an insurance premium they're paying, and they might be eligible. As far as the screening goes for the MSP, I imagine that you have other programs you're screening for, so there are a lot of different steps that you're going to take. But for the MSP specifically, you check to see whether or not they have or are eligible for Medicare. You look at their marital status and whether they're living together with their spouse. If two spouses are married but they don't live together, they're considered single. Yeah. Look at the income resources, and it's really important. Check for income disregards. So the income disregards are those Medicare, Medigap insurance premiums, other types of insurance premiums that may be able to be subtracted. As far as dependent children, unfortunately, dependent children don't really increase a person's eligibility limit for the MSP, which can be very, very unfair for people, especially parents who maybe they're 66 and they have Medicare and they have a kid or they have two kids, but their income eligibility limit is either based on a single-person household or a two-person household. It doesn't keep increasing for more kids in the house. You would also obviously want to talk about Medicaid too. This is a really important point. People can have Medicare, the MSP, and Medicaid. They can have all of them. But oftentimes, they might just call you and they might just have Medicare and Medicaid. We call it dual eligible. They don't necessarily get the MSP automatically. They may be having their Part D premium taken out of their Social Security check. So it's really important to check to see whether or not that Part D premium is deducted and to look at their income level. Now, if you all look at the chart, the green income limits, there you'll see the income eligibility for Medicaid for age 65 disabled blind people, and then you see the income eligibility for QIMBY. So regarding Medicaid, how many people here are familiar with the Medicaid Spend Down program? You went over it? Okay. So just really quickly, it's where you pay in a certain amount of money or show a certain amount of paid or unpaid medical bills, and then you get a certain period of Medicaid coverage. Well, Medicaid is, eligibility for Medicaid is determined in part very similarly to how the MSP is determined for people who also have Medicare. However, the difference is that if they have a Part B premium that's being taken out of their check, they have Medicare and Medicaid, and maybe they have a Medicaid spend down. That $104.90 in Part B premium is disregarded from how much of their income is counted for Medicaid. So it's subtracted from their income. They might have $900 a month in income, $104 is taken out for Medicaid, or excuse me, for Medicare Part B. So for Medicaid, their countable income is $900 minus $104. So they're eligible for Medicaid in part because they have that premium deducted. If they apply for the MSP, they could be pushed into a Medicaid spend down and have to pay a certain amount of money each month to Medicaid or show medical bills to continue to get that continuous Medicaid coverage in addition to Medicare.
That's actually not as good.
It depends on the client. It really depends on the client. Sometimes, for example, getting Medicare and Medicaid and the MSP gives somebody a spend down that's very small, like $20 a month, and they can meet it. They can write a check to Medicaid each month, or they can show a medical bill or something. So it depends on the situation. Also, sometimes people don't use a lot of services that only Medicaid covers. So if people need dental, vision, comprehensive dental or vision care, or long-term care, those are things that Medicare absolutely doesn't cover. You know, certain Medicare Advantage plans might cover it a little bit, but it's kind of like a lousy benefit compared to Medicaid's benefits. But if they aren't using a lot of that, then the MSP might be a good option. When you enroll somebody for enrollment, Katie, do you folks send everybody to us?
For what?
The MSPs?
Nope.
No.
We
Okay.
have 2 deputized agents here, Priscilla and I, and no, yeah, we don't.
Oh, but the MSPs, they go to us because they're deputized
Right,
agents.
but we don't send the client to you.
No, you don't send the client to us. Okay. All right.
And neither will you guys. You won't send the client.
Okay. Glad to clarify that. But the MSP application will eventually arrive at our desk
Right.
in some way, shape, or form.
Right.
But it goes to the 2 deputized agents or caseworkers here. So those are the individuals who can make the determination about the Medicaid with the spend down or not and counsel people about that. I always lean towards helping clients get referred for as many benefits as they're eligible for, and maybe even helping them apply. And then later on down the road, they can choose whether they want the Medicaid with the spend down or to get the MSP paying their Part B premium.
So in terms of so Medicare doesn't, we talked about yesterday, and we just said doesn't cover like some comprehensive care and dental, things like that. And so if you have Medicare and Medicaid, I guess I thought that Medicaid covered that stuff, so it doesn't because it's just supplemental to Medicare.
No, it does. It does. What I meant is that if somebody's having to choose between having Medicare and the MSP, or having Medicare and Medicaid, and then the MSP pushing them into that Medicaid spend down, because they have that premium being paid for, and so they might choose to leave Medicaid. That was the situation I was talking about, where somebody has Medicare and Medicaid, but then getting the MSP might push them into a spend down.
I guess I'm just confused. I don't know why would you want that?
Why would you want that? You
like,
might.
Does the care change?
Why would you want Medicare and Medicaid?
No, why would you want, if you were in Medicare and Medicaid and you wanted an MSP and it was going to push you into a Medicaid spend down, why would you want that?
Well, first of all, a huge number of the clients will not get pushed into a Medicaid spend down.
Okay.
If it does push you into Medicaid spend down, it might be small. It might be much less than the premium that's getting paid for on your behalf. It might be $20 a month.
Oh,
but you're getting $104 a month back into your check.
Okay.
So you have a net benefit of $80-ish.
So you're getting the same health care benefits plus the premium paid for.
Yeah.
The money.
Exactly.
Yeah.
Yeah. Yeah. And as far as the Medicaid covered benefits, if you have Medicare and Medicaid and it's a Medicaid only covered service, then Medicaid pays primary and Medicare's not involved at all.
Okay.
As far as the Medicare Savings Program timeline for applying, it's supposed to be 45 days, but it can take several months for it to go into effect. If clients ask how long it takes for them to get this benefit, you might say, unfortunately, it does take a little while. You don't have to tell them that it's going to take 5 months. It probably will. And that's because data has to be shared between the HRA Medicaid office, the state of New York, Centers for Medicare and Medicaid Services, and Social Security, and their Part D plan also. So it takes a while. Does anybody have questions about eligibility or budgeting, screening for the MSP? No? Okay. So once you get the MSP, you want to make sure to recertify it. Just like Medicaid, you'll get clients who get it should get a notice in the mail about 9 months after their effective date saying you're coming up on your renewal or recertification date, and you need to sign this form and date it and send it back saying that, yes, the income information we used to budget you last year is the same as it is now. If something's changed, the client may have to add that information to the recertification form. The issue with these is that sometimes people don't get them. And so if people don't get them, we always counsel after notifying folks they've been approved for the MSP. We always say, set something on your calendar. In 9 months after your effective date, if you haven't gotten that renewal form, call the Medicaid office and say, why haven't I gotten it? Send me another one. And make sure they get it in on time, because it's so much easier to recertify for these benefits than to have to reapply. And on that note, the same rules apply for extra help, but in a different but similar way. You have to also renew extra help. So we've talked now today about a bunch of programs for people making, around up to about 140% of the poverty level, or $1,300 a month, a little more for a single person. There's also a program for people 65 and older. It's called EPIC, and as you will see, there's a $75,000 individual income limit and $100,000 for a couple. It's not a low-income program anymore. It only helps people who are over 65 and have Medicare. So it doesn't help the people who have Medicare because they have disability income, unfortunately. People are eligible for EPIC, which covers Medicare Part D costs while people are in the coverage gap, the donut hole, and it limits copays to a maximum of $20. They depend on a person's income and whether they've gotten through a deductible for EPIC, but ultimately after they get through an EPIC deductible, they only have to pay no more than $20 for a covered prescription. Again, it depends on their income and other things. People are eligible if they don't have full Medicaid benefits. So if they have a Medicaid spend down, they can get EPIC, but they can't get it if they have full Medicaid. And if they have the MSP, they definitely can get EPIC. One or two real key things about EPIC that they're really important to know. And I'm going to pass around this brochure. Part D, some Part D plans cost more than the amount of money that extra help will pay towards the monthly premium. So a Part D plan might cost $50 a month. And I guess we don't have enough of these.
Did we get it? I got it.
Oh, you got one? Okay. So extra help will only pay up to, I think, $37.22 a month, or maybe it's $32.77, whatever it is, per Part D plan. And so if this is the case and somebody has a more expensive Part D plan, then they have to pay for that themselves. EPIC will pay up to that same amount extra help will pay. So you can get double the amount of a Part D premium covered. If I have a $50 Part D premium and I have both extra help and EPIC, then my Part D plan is completely free. And for people who have extra help, and again, that's anybody who gets the MSP, anybody who has SSI, anybody who has Medicaid or who applies for it directly, who also gets EPIC, they have all their fees waived and they don't have any deductible or anything. So there's no additional cost to getting EPIC if you also have extra help. It just can pay additional towards your Part D plan. And for people who don't yet have extra help or who don't yet have any of these other low-income programs, EPIC does provide a once-a-year special enrollment period into Part D. So somebody might call you saying they don't have Part D. And if they enroll into EPIC, you're eligible, they can pick a Part D plan outside of the restricted annual enrollment period. So they wouldn't have to wait till January 1st of the following year to get it.
So EPIC is really good for people who are single or a family that has over the QI and MSP level, right?
And who's 65 and older.
Right, it's kind of the only help for them that they can have.
For health-related stuff,
yeah,
most likely. And unless they have insurance premiums that help them get the MSP. So with that, we talked about the Medicare Savings Program. We talked about extra help. We talked about SSI briefly, and we talked about EPIC. And again, if there's nothing else that you take away from this presentation today, it's that the MSPs pay the Part B premium, and that a very, very low percentage of people eligible for these programs are actually enrolled. And so it makes screening them for them and referring them for enrollment all the more important. If you have questions, I guess you don't contact the Medicare Rights Center, you contact your helpline supervisor. In addition, I imagine you have internal resources. There's also our tool called Medicare Interactive at medicareinteractive.org. And it's basically like Google for Medicare. So you can type in a question like, do I qualify for Medicare if I'm 65? And there will be an answer. And certainly more questions than that. So I would encourage you to use that if you have a question. And it's very easy to use, user-friendly. Does anyone have any questions about anything related to the presentation or Medicare? Well, I do appreciate you taking the time today to come in and go through the training.
Thank you. Wow, you got 2 things?
Yeah.
That's amazing.
That's not even lunchtime.